All right, next we're going to talk about long-acting contraception, starting with Nexplanon, which is a little rod that goes in the arm right in between the bicep and the tricep muscle. Your doctor puts it in. Lasts 3 years. It's about 97-98% effective. And it is progesterone only, and it's absorbed through the rod, and that blocks ovulation from occurring. That's how that works. But because it's progesterone only, just like we talked about with the pills before, it does cause random bleeding. It does. Some people, they still will get a period and they'll get the spotting, and other women won't get a period, but they just get tired of the random bleeding that occurs with it. So there's Nexplanon, and then there's the intrauterine devices, or IUDs. Now, initially, IUDs used to scare women because the original one was called the Dalkon Shield, or one of the original ones, actually. Dalkon Shield caused horrible pelvic infections, and that would lead to infertility. Not only infertility, like big surgeries to take out everything, because they caused abscesses in the pelvis. So nasty Dalkon Shield. So IUDs were thought, well, maybe they can increase the risk for pelvic infections. They did take the Dalkon Shield off the market, but there was still that fear. That turned out not to be true. So now we can offer it to young women. It used to be only given to women who already had children, and that way if you caused an infection, you wouldn't, they'd still have children. Now we can use it in young women of any age, really, because it does not have that risk. And I even had a patient who had pelvic infection with abscesses, and we left her IUD in place, and she did great. She didn't even need surgery. She responded to antibiotics. So IUDs, the one that's been around a long time that is completely non-hormonal is called the Copper T, or the Paragard. And Paragard lasts for 10 years. It costs around $900 to $1,000, but it does last 10 years. So it's pretty cheap in the long run. It's just hard for women to come up with that, that money initially. But it's a great method for women who don't want any hormonal contribution. The way IUDs work in general is they block sperm from getting to the egg. They create a hostile environment in the uterus and with the cervical mucus so that sperm can't ever make it to the egg. Now, the copper IUD can be placed, or the Paragard can be placed as emergency contraception for women who have either unprotected sex, or the condom breaks or something like that. If it's placed within 3 days, it will stop the embryo from implanting if a woman does get pregnant from that initial act. So that one, because it creates that hostile environment inside the uterus. Now, the progesterone only ones also thin the lining and create a hostile environment by just not allowing anything to make it through again to the egg. So the progesterone only products are mainly for women who want the long-acting part of the birth control, but maybe they have horrible periods. Because the one thing about the copper IUD is that if you have really bad, crampy, heavy periods, especially the first 6 months, it can make them a little worse. Now, studies show that probably goes away after 6 months, but you can imagine if women are already having issues with that, or their periods are extremely irregular, it doesn't help that at all. So they thought, well, how are we going to have an IUD for women who have bleeding problems, or who have, extremely bad cramps and things like that? And they came up with progesterone, because when progesterone is sitting inside the uterus, it blocks estrogen from making a lining, and that really can block women from having periods. Now, initially, again, random bleeding. Some women do get a little menstrual cycle, some women don't, but with time, as time goes on, especially after the first year, a lot of women will not even get periods at all. It ends up being about 50% of women have no periods. They'll get occasional random spotting like every few months, so they really love it, especially if they have a history of endometriosis or bad menstrual cramps or really heavy periods. So that's the advantage to the progesterone, different types. The one that's been around for the longest is called Mirena. Initially, it lasted 5 years, but now it's lasting about 8 years. So that's nice. It's gone up in that effectiveness. Liletta is another one that lasts about 8 years, and both of those emit about 20 to 21 micrograms of estrogen a day. Then there's Skyla, which has the lowest daily estrogen. It's 14 micrograms a day, and that one lasts 3 years, and it's a little smaller. So, initially they thought if a woman has a very tiny uterus, that would work really well. Kylena lasts 5 years, and it puts out about 17.5 micrograms of progesterone a day. So those are the different options. They're expensive, but I have to say they're around $1,200. Most insurance plans will cover the cost of those now. And side effects of IUDs. Okay, so we talked about copper T with the heavy periods and the cramps, maybe especially at the beginning. The other funny thing about IUDs is obviously your uterus can expel it, and if it kicks it out, then it doesn't work very well. So, but that doesn't happen very often, and so there's that. And then there's really rare risk of pregnancy. These are the most effective methods of birth control. They're about 98% effective because you don't have to rely on someone to do something every day or every week, and so very effective birth control. But if you happen to get pregnant with an IUD, most of the time it is going to be a normal pregnancy in the uterus, but there is a risk that it could be a pregnancy outside of the uterus called an ectopic pregnancy, the most common place for that being in the fallopian tube. And again, very unlikely because it's such an effective method. So that's one thing. And then there are some issues with moodiness and acne and things like that with the progesterone IUD. So again, every woman is different. So if you have someone who takes it and feels like there's something off with their moods, then you have to take that seriously. And the only way you're going to ever find out is to remove it, and if they go back to normal. And the weight gain, very low risk of weight gain, but again, everyone is different. The progesterone you're getting through the IUD is the smallest amount of hormone compared to other products. So luckily, I think those are less likely to occur in general. And the progesterone only, again, the random bleeding, sometimes that's probably the biggest reason women don't want to use the progesterone only products, is the random bleeding. Because some women will get a period still and then they spot, and then after a while they don't like that. I always say try to tough it out for 3 months and see what happens. And then if you can make it to a year, and as time goes on, the periods disappear, and that's really a nice benefit for a lot of women who have really terrible periods. The other really rare thing that can happen with IUDs is that the uterus is a muscle and it can cramp. And if that woman has an abnormally shaped uterus, or it's put in funny and it just pushes into that wall a little bit, it could contract it and it can end up pushing it into the peritoneal cavity. Really rare. I've had patients sent to me to have them removed because the ultrasound and x-rays showed that the IUD was floating in the abdomen. I had one patient that was going to run a marathon and it wasn't giving her any problems, so I told her to go ahead, and then afterwards we removed it with laparoscopic surgery. Again, very rare, but it does happen, and it requires surgery because you don't want to take the risk of eventually that IUD causing a problem with the bowel, because that's what's floating around in there, the bowel, and it gets tangled up in that. What else about the IUDs? I think that's pretty much it for that. Sterilization, and again, a lot of women think that it's 100% effective. It's really not. It's pretty good though. It's 98, 99% effective, but the fallopian tube somehow can magically heal themselves after a tubal ligation. So you can never be 100% with that. Obviously, vasectomies, you can prove that the sperm aren't there after 3 months, and and it's much less likely to occur. And it is a surgical procedure, right? So there are risks associated with that, with sterilization. The other things, just briefly mentioning, I do have some patients who do the fertility awareness, which is, family planning is what we used to call it, where they really can track their ovulation and avoid intercourse before, during, and after ovulation because there's a window there. And some women who have extremely regular cycles are really good at it, but I usually don't recommend it unless my patients are in a long-term relationship, and if they did get pregnant, it wouldn't be, a big deal to them. And man, you have to be on it to do that and have regular periods. If you don't have regular periods, it's out. It's out as a method. And then withdrawal, we don't recommend it because it's user dependent and you're depending on someone to be 100% with it, and there can be a little bit of sperm on the drop at the end of the penis before ejaculation occurs as well. So that's that one. Oh, morning after is the last thing I wanted to chat about really quickly, because these are effective products. They can prevent pregnancy they're about 80 to 85% effective. And Plan B is over the counter. You have to take it within 3 days. It's progesterone. It will, afterwards, some women will have some side effects from that big dose of progesterone. They just feel off, or it will muck with their menstrual cycles for a little bit. And then there's Ella, which is a prescription progesterone emergency contraception, and that one can be taken within 5 days. Obviously, the sooner the better, right? The sooner you take these things, the more effective they are. And then I already mentioned the copper IUD, which can be put in within 5 days as well. Better to not need to use that by being really responsible. Yes, so we'll talk a little bit more about that on another time, but I wanted to introduce my little helper, Roxy, who's been in and out. So, anyways, I hope that's helpful. I know it's long and it's a lot of information. If you have questions, though, because I'm sure I missed some things. If you have, I did miss something really quickly. They're coming out with a couple of things that I just wanted to briefly mention. They're coming out with another copper IUD. They're calling it copper IUB for whatever reason. That's going to last about 5 years, and it's kind of where it's going to put out a little bit of copper every day. So I'm not sure what the advantage to that will be, but that's coming. And then there's also, they're always looking into contraception for men, but honestly, those just haven't really worked out yet. They're looking at a capsule, OUI, like we in French, a non-hormonal vaginal capsule, which is kind of interesting because it's non-hormonal. But again, those are not available at this time. Anyways, that's really the end. Thank you. Please give me questions so I can make sure I didn't miss anything.